Welcome on this spring day full of hope. Always lots of hope, and you know what? That's the mantra that we need to have today, is lots of hope and planning for the future with a sense of optimism and a solutions-focused approach. So today is all about being positively focused, solutions-focused, as we work through the day to come up with recommendations that will help ensure, that we have the right medical treatment in place to ensure that the province's healthcare system is well equipped to meet the future medical needs of the seniors of an aging population. So the work that we're going to do today is going to serve as an important focus on medical treatment, solutions-focused, positively focused, that can also support then the province's development of its long-term care strategy. You all have in front of you a package, including an agenda. I'm not going to go through the agenda with you in detail right now, only just to let you know that what we're going to be doing this morning is hearing from several individuals who will sort of set the stage and introduce some thinking around some models of or strategies that can be used for the medical treatment of a seniors population. And after that, we're going to do some work here in this environment where I'm going to facilitate a discussion with you to see if we can pull out from this morning's presentations, as well as your own views, around some of the essential elements that could be or should be considered in a medical treatment, in a medical model for the care and treatment of a seniors population. And then after lunch, you're going to be doing some work in small groups with the assistance of a small group facilitator. There are some of you who have volunteered to take on that role, and thank you very much for that. And what you're going to be doing in those small groups is taking a stab at developing a medical model for the care and treatment of a seniors population. Later on this afternoon, we're going to hear from your small group facilitator. We're going to hear those reports. And then we're going to take a step back and say, okay, out of all of that, what are some of the immediate or short-term wins or solutions that could be pursued, and which of the things that have we identified jointly are more of a longer-term nature that need to be pursued. Now, with all that said, I probably should introduce myself. My name is Jane Heller, and I'm a management consultant. I have a firm called Jane Heller and Associates that's based here in St. John's. Most of my work is somehow or the other related to the healthcare system. It's the system that I grew up in. It's the system that I love. But my role here today is as a facilitator. So that means I'm sort of the manager of the day. I need to make sure that we stay focused on the task at hand and that we end up with a good outcome. My role is not to add anything at all to the content. That's your responsibility. You're all the subject matter experts. So my job is to make sure that we hear from all of you. The other role that I have is to produce a What We Heard report, and that will be put together based upon everything that you say today, all of your input, and some of the flip chart notes and all the recordings that are going to be done sort of on the side. So that's my responsibility as well. And Pat will likely talk about how that What We Heard report will be used by the Newfoundland and Labrador Medical Association on a go-forward basis. You can probably see that there's a lot of equipment in here. This is all going to disappear after break, by the way. But it's all here right now because we are video recording the presentations that you're going to hear this morning. These will be posted on the NLMA website, and there's a process that Jonathan's stepped out of the room, but I'm going to ask at some point, Jonathan, just to describe the process that will be used for how those presentations, how that will be used to gather additional feedback from a wider population than what's here in this room today. The other thing I would like for you to note is that the media is present, and the media will be here just for the presentations, and we'll be leaving after that. So that'll be around 10 o'clock. Then we're going to take down all this equipment. One other thing, I've been informed that there is someone in the room who has a very severe nut allergy. So if you have anything in your purse or in your pocket that you think has nuts in it, it's best to leave it there and not to take it out of its wrapper. Leave it where it is. I think it's really important for us to understand who's here in the room. So I would like for us to go through, and if you could introduce yourself and what you do for work, that would be really helpful. So if we could start right here with Anne.
Good morning, everyone. My name is Anne Slater. I'm an internal medicine and geriatric medicine specialist, geriatrician, and I teach the medical students geriatric. And I know all of you, although some of you, like Erin McKim, I've only talked to you on the phone for 8 years, so the cool part is meeting you. Thanks.
Thank you.
I'm Vinod Patel, Clinical Chief for Long-Term Care at Eastern Health. I'm in general practice. St. John's.
Thank you.
Julian Vaughan-Jackson in general practice. I work at Glenbrook Lodge and St. Luke's.
Thank you.
Hi, I'm Aaron McKim. I'm a family doctor. I also work in the emergency medicine department and seniors care at Glenbrook Lodge.
I'm Pat O'Shea. I'm a GP in St. John's. I do a lot of house calls along with Percy Crocker, and I also look after patients at Chancellor Park, St. Pat's Nursing Home, and Kenny's Pond Retirement Residence. And I'm the president of the Medical Association of Canada for 72 days.
I did not know any of us at all.
I'm Merrill Asnan. I'm a psychiatrist with specialization in geriatric psychiatry and psychosomatic medicine.
I guess I should introduce myself. I'm Deanna Sullivan. I'm with the Telegram, just here for a couple of hours. I'll be gone again.
Percy Crocker. I am family practice, Newfoundland Drive family practice with Dr. O'Shea. And I look after sort of a lot of geriatric population with house calls and also Chancellor Park and Kenny's Pond.
I'm Paul Bonsteele. I'm a rural family physician in New Harbour, Trinity South, and I'm in general practice there. I don't attend any nursing homes anymore, but I do look after some personal care homes. I do also do a lot of house calls, and I'm proud of the fact that we have a lady in the community called Aunt Elsie, who is 103 next month.
My name is Roger Butler. I'm with Discipline of Family Medicine. I work at the Ross Center. I teach family practice residents geriatrics, and I also do house calls, which is a bit of an oddity, I guess, these days. And we teach our residents to do house calls.
I'm Alice Kennedy. I'm Vice President with Eastern Health. I'm responsible for long-term care.
Good morning. I'm Bruce Cooper. I'm the Deputy Minister with the Department of Health and Community Services. I'm responsible for helping to develop strategies to move issues like this forward.
Great to have you here. Thank you. Behind Bruce.
Suzanne Harris, and I'm Regional Manager of Placement Services.
Okay, great.
Hi, I'm Debbie Morris. I'm the Acting Director of Long-Term Care and Community Support Services with the department. I work with Bruce.
Hi, good morning. I'm Glenda Compton. I'm one of the Regional Directors for Long-Term Care with Eastern Health with my colleague Judy O'Keefe.
Okay, great. Thank you.
Hi, I'm Pam Kerr, Resident Care Manager at Salvation Army Glenbrook Lodge.
Hi, I'm Therese Smith. I'm from the Health Nurse.
Thank you.
Hi, I'm Carol Snellgrove, and I'm a social worker, and I work directly with seniors in the community.
Thank you.
With Eastern Health.
Thank you.
Of course.
I'm Kathy Hickey, and I'm a geriatric psychiatrist, and I work at the day hospital at the Miller Center.
Thank you.
My name is Deborah Craig. I'm a community mental health nurse with geriatric psychiatry. I have 2 weeks left in this position. I'll transitionalize into a new position, discharge liaison nurse at the Mother Hospital. Easter Way, again with seniors. Thank you.
Hi, I'm Linda Turner. I'm a nurse, a geriatric psychiatry referral coordinator, and I just started this position.
Oh, welcome.
I'm Brenda Wakeham. I am the geriatric psychiatry referral coordinator, but I'm leaving as of Monday, and I'm going into Deborah's job as the community mental health nurse. So,
Send us a memo, will you?
And I'm Judy O'Keefe, I'm Regional Director for Long-Term Care with Glenda. And just to give you some perspective, I guess in Eastern Health, we're responsible for over 4,000 long-term care beds, including personal care homes and nursing homes.
Thank you.
Good morning, I'm Larry Kelly. I'm Program Director for Adult Rehabilitation, Palliative Care, and the Hospital in Belle Isle, Leeds.
Thank you.
Hi, I'm Daryl Coos. I'm the Division Manager of the Health Science Emergency Department, and the only house call I do is my own.
I'm Kelly Deary. I'm the social worker at the Health Sciences Emergency Department.
Thank you.
Hi, I'm Michelle Clark. I'm the Division Manager of St. Clair's Emergency.
Thank you.
Good morning, I'm Terry Jean Murray. I'm the Social Work Manager for Clinical Efficiency, Eastern Health.
Hi, I'm Liz Kennedy. I'm Regional Director for Clinical Efficiency for Eastern Health. And I guess to put a little bit of context around it, I look at access to services and wait times right across the continuum. So our goal is to try and ensure that patients, clients, residents, no matter where they are, receive timely access to the right care in the right setting. So whether it's community, setting up home support, long-term care, getting their surgery in time. So that's a mandate and it's regional right across all of